Hello, I'm Dr. Sanjay Totlani, consultant neurologist at Royal Bahrain Hospital, and today I'm going to talk about an exciting treatment in a very big disease that happens in neurology patients called stroke. Now, stroke, as we know, is damage to the brain which can happen either due to bleeding or due to clotting. 85% of the time, the strokes happen due to clotting in the brain. A sudden clot goes into one of the big vessels in the brain and causes brain damage. Now, initially there was a lot of nihilism that nothing can be done for patients with stroke. It will take time for them to recover. There are no medicines for the immediate treatment of stroke. Well, that's not true anymore. For the last 10 to 15 years, there is a very interesting treatment called thrombolysis in stroke, in which the clot that happens in the brain is dissolved by a medicine, but only it has to be done in a protocolized manner in a center which is capable of doing this. And our center has recently protocolized this therapy, and we are doing this therapy in which we give a medicine to bust the clot. The only issue is, how do we recognize stroke? So, if you or any of your relatives notice that the concerned patient has got drooping of the face or weakness of the arm, which stands for A, face for F, and if there is any involvement of speech like inability to speak or slurring of speech, which is S, then we should note the time when all these problems started and immediately get the patient to the hospital. So it can be remembered by the mnemonic FAST: F for face, A for arm, S for speech, and T for the time when the problem started. Now, important thing is that the time frame or the time window in which this therapy can be carried out is up to a maximum of 4.5 hours, and we need the patient to be in at least 3.5 hours to the hospital, so that the hospital gets time to do the tests and give the medicine within a period of 45 minutes to 50 minutes. Now, you might wonder, how many patients are helped by this therapy? So, well, almost 36% of patients will show some improvement, 16% of patients will show complete improvement. There will be another about 60% who will not show improvement, who will be like they were before, and there will be 3 to 4% of patients who might develop complications like bleeding in the body or in the brain. But having said that, the important thing is that more than 1/3 of the patients will benefit from therapy, and this might be a difference between life and death, because once a patient becomes bedbound due to stroke, then he doesn't survive too long. To conclude, I would like to say, time is brain, and if anyone of your loved ones does have this problem of stroke, then we, the neurology team at Royal Bahrain Hospital, are here for you. Thank you.